Well, we all love our pets. We have two right here, of course, and sometimes we have questions when it comes to their health or strange behaviors or the whole other lot of things.
That's right, and lucky for us, our resident veterinarian is here to answer your questions. Welcome back, Dr. Eric.
Morning, guys.
From the St. Paul Pet Hospital, and look at, of course, we bring
puppies.
Butter and Butter's puppies.
Well, they're big enough now that we can't just let them run around on the floor because they would disappear on us.
I mean, just puppies. What else do you need to say? It's
I know,
Monday
right?
morning. You brought your
We'll
puppies.
just stay silent here for the next 2 minutes, and I think everybody
Let's
will
just
have
look at puppies.
a better Monday morning.
Okay, we actually are going to start with some issues. There is a pug out there named Bella who just loves to chew, and Pam asks, will you give us thoughts on those edible, long-lasting chew bones? Is rawhide bad? Or what do you think about bully sticks, collagen sticks? We'd love to hear your thoughts.
This is a really good question. I probably get this one at least weekly in the clinic. Chew toys, and we got to think about why do dogs chew to start out with this. A lot of dogs need neurologic stimulation, and they're sitting around and they want to do something with that. And historically and evolutionarily, that was a really advantageous thing, kind of clean their teeth off. So a couple of the products that we have out on the market, we have sort of edible chew treats, and then there's non-edible chew treats, and I can kind of break those down. We think of those bully sticks. Those are actually a dehydrated steer phallus. So that's what those are. Those are broken down and cut up. Those work out okay. There's a lot of fibrin in those, but those do help. Those are okay. I usually will lean towards that versus like the straight up rawhide bones or the rawhide skins. Rawhide is just pure fat. That's all it is.
Really? Okay.
And I've actually gone into surgery and had to cut pieces of those out before because if they swallow a chunk of the bone that's folded up on top of itself, it stays hard when it goes through the GI system, and it can get stuck at the pyloric outflow of the stomach. So I don't particularly love just straight rawhides. One thing to pay attention to if you're in the dental section of any of our pet stores, there's a label, the Veterinary Oral Health Council, VOHA or VOHC, is right on the label for some of the approved products that are non-edible products, like our Nylabones. There's a new product out there called Go Nuts. It's GOUGH nuts.com.
Okay.
They make an awesome rubber chew toy that once the dog chews it down to the middle, there's a red center that gets exposed, and you can send it back in and they'll resend it. It has a lifetime guarantee.
Wow.
It's an awesome product. It's a really interesting product. So that's one that I found just recently that was really, really cool.
What about the Nylabone? You touched on that.
I love Nylabones. Those were designed by veterinarians and by veterinary dentists, and those are pretty much indestructible. They're very safe. One thing to remember, I always say no to bones. So I've always kind of said that. My cousin Mike, if he's watching right now, he and I got in a conversation about giving venison ribs to your dog, and I said, please don't do that. Yeah. Of course, a lot of dogs love it, but I also get stuck in the position of having to remove bones or fragments from dogs' stomachs if they puncture through, because those are sharp. We think about it, wolves in the wild do not live as long as domestic dogs. Those are some of the reasons, okay? So those are kind of dangerous things. So please no bones and please no sticks, all right? Wood sticks also get lodged in there too. I've taken those out. So
I have to keep those away from my dog constantly.
Yeah, hopefully that clarifies a little bit of that, Pam. So.
All right, next up is April. She says, my cat had surgery years ago. Now he refuses to get in the carrier to get shots or go to the vet. Any advice how to get him in the carrier?
So rather than working with this carrier, and I get this question a lot very commonly too, it's like there's an old meme about that vets have usually in the back of their treatment areas of the cat going to the clinic, and it's like, oh my God, like this is it. And the dog, it's like, do you want to go to the vet? And they're like, yeah, this is great, I get a treat. Yeah. Rather than fight a cat to go back into their carrier when they've had maybe a negative experience, and those of us who have kids, like going to the pediatrician is not fun, right? And there's no way to get around that. You could try to tell them you're going someplace else, but they'll figure it out eventually once they pull in the parking lot. But with your cat, just getting a different carrier rather than trying to bang your head against the wall. And the new carrier should only be associated with positive treats, right? So don't try to play games with a cat like that. They're smart. They're like way too smart. Like I always say I need a pet dumber than I am, and that's the pretty high threshold actually. So just don't play games with that cat. Just go ahead and just get a new carrier, and that's what I would recommend. And then only associate the positive treats with that new carrier. So that's what I would do.
That's good. All right. Next is Elin, and she says Bentley is her 5-year-old mini golden doodle. Elin says he randomly throws up about once a month and wants to know, is this normal?
I kind of think of any episode of vomiting is really not normal. Cody, if you were vomiting once a month after you ate.
No, it would be not normal.
That's not normal, right?
Yeah.
Like, that's not normal, I think. And I'm going to look right in the camera to the cat people out there. If another person comes into the clinic and says, my cat vomits every week and that's totally fine, he's okay, please see your veterinarian and talk about that. Because I think a lot of people normalize that stuff, right? So I start thinking about, probably initially, if it's that infrequent and the dog is not losing weight, I usually think about a food indiscretion or some type of food insensitivity. I'm not saying that your dog is allergic to chicken or beef or anything like that. Remember from previous episodes that we've done, food allergies are very rare. But food insensitivity is like something that they eat and they don't like and then they puke that food back up. That can be something. So switching a food to a blander food or something that has less fat, there's a few prescription diets that veterinarians will recommend. Go that route. The next thing is, if a dog is losing weight and they're kind of intermittently doing that, obviously a fecal sample to check for intestinal parasites and doing blood work to see if there's any metabolic conditions. There are so many conditions that I come into where a dog has been or cat has been chronically vomiting, that it's a chronic internal metabolic condition, and the first thing, or a serious condition, or a kind of whatever condition, vomiting is almost always the number one condition that veterinarians we get saddled with. That's the number one clinical sign that we see. So not to scare people out there, but if your dog vomits once, that don't rush right in. But that's something that I would probably look at. So maybe getting an appointment with your veterinarian if you've tried a couple different foods and nothing is really working, because they're going to test for more things.
All right, good to know. Finally, Melissa, she has a question. She says her 6-year-old pit bull is overweight and needs knee surgery for a torn ACL. She asks, until surgery, would you recommend a knee brace?
Melissa, you're kind of stuck in with a lot of the bully breed owners. An ACL in a dog is a degenerative condition. It's not really like the 30-year-old guy that goes out and plays softball for the weekend and blows his knee out. Two very, very different conditions, although it's the same condition, but a very different pathology. So can you put a knee brace on a dog? You can, but when you think about a knee brace in a person, there is very specific adjustments that have to be made to that regularly, and a knee brace can pinch off blood supply really fast to a leg. So in dogs, we do not recommend that at all, because the dog's not going to give you feedback and say, well, right here, you got to put a little more pressure there. Yeah. You cannot do that. And so actually, we see more tourniquet situations that happen secondary to knee braces, and dogs that require either PT to just fix the problem from the knee brace, or sometimes in the worst cases, amputation. So please do not, knee braces are just really not that advisable for an ACL in a dog. And obviously Melissa was kind of hinting into it. Keep our bully breeds, our dogs, just keep them underweight. Every pound of weight that you're over, you're putting 4 pounds of extra torque on the dog's knee. So just remember that. So,
okay.
Yeah.
Good information,
yeah,
as
good
always.
Advice. And thank you for the puppy
thank
therapy.
You, Butter and puppies.
I think they're all asleep now.
Zonked out.
Wait.
Way to go, Cody. You just jinxed it. Now all is up. So,
Dr. Eric Ruhland, thanks so much for joining us. Good stuff.
Thanks, you guys.
For more information, you can go to stpaulpet.com. And if you have a